For the diagnosis, the first sample that I will take will be a stool sample, and the clinical rule is that I have to take a 3 consecutive day stool sample before I rule out this. So 3 days consecutively ask the patient to get his diarrhea sample to your lab. In the stool sample, either you can see the trophozoite of this or you can see the cyst form. When I see the trophozoite, I can very well notice that there is red blood cells being eaten up. I know that is erythrophagocytosis. And it has how many nuclei? I can see only one nucleus which has a central dot known as central karyosome. So the nucleus with that central dot gives a cartwheel appearance. These two buzzwords are important. The trophozoite shows you erythrophagocytosis and cartwheel appearance. Very, very important. That's the trophozoite. Now let me talk about the cyst form, in which I can see anywhere between 1 to 4 nuclei. I can notice in this I have the 4 nuclei stage, and there is a very, very thick body which is known as the thick chromatoid body. That makes a cyst form. Let me show you real pictures. This over here, if you notice, is the red blood cell eaten up, and here you can see a nucleus with a central dot which is the cartwheel appearance. So this is the trophozoite. Now when I show you the next picture over here, I can again see only one nucleus. I thought that okay, trophozoite also has one. The cyst has anywhere between 1 to 4, but this has a thick chromatoid body or bar, so this has to be the cyst form. This is Entamoeba histolytica. If you give this diagnosis, the clinician will start treatment, which I will tell you in a while. But sometimes in the stool sample, I also get to see Entamoeba coli. Before I explain that to you, this is a normal parasite which can be found in anyone's intestine normally and can be found in anyone's stool sample also normally. So if this is found, don't start giving unnecessary drugs to the person. How does Entamoeba coli look like? Again, it has a trophozoite form and a cyst form, and keep comparing it with Entamoeba histolytica. In Entamoeba histolytica, you had a central karyosome. So in Entamoeba coli, you have a karyosome at the eccentric, a little periphery, so it will not show you the cartwheel appearance. How many nuclei? Again, it has only one nucleus. That's the trophozoite. But when I come to the cyst has anywhere between 1 to 8 nuclei. You can count in so many pictures that I have put up over here. It has 8 nuclei, and the chromatoid bars are also very, very thin out here. I just revised the nuclei with you. In Entamoeba histolytica, trophozoite versus cyst. Trophozoite had 1 nucleus, cyst had 1 to 4. In Entamoeba coli, the trophozoite has 1 nucleus and the cyst has 1 to 8. My question here is that this chromatoid body, be it thick or thin, what is it? What is the composition of a chromatoid body? And the options will write RNP, ribonucleoprotein is what it is made up of. Now a question for the INI-CET students is, what is the special stain of a chromatoid body? It is iron hematoxylin, which you have to mark.